Welcome back. It's the Rick team. It's been a while since we've done a podcast. Today we're fortunate. We've got Dr. Chris Romig with us here. So Eric and I, we're all kind of zooming in on a remote podcast, the three of us. But this has been probably more than a year and a half in the making that we've been talking about this. And Chris has been a huge advocate for all of us. Just a priceless resource that we have been fortunate enough to partner with on multiple things. We started out with the original partnership where we discovered the SGB, kind of started sharing it with other people, found a local place that we started sending people down to Irvine, which is where Doc was based out of, and seeing quite a bit of benefits, obviously, from the shot. I mean, Eric and I talk about it all the time. Eric you had yours done with him, obviously. So, anyways, we're just gonna have a conversation with the doc today. So, thanks for coming on with us, Doc, and sharing your insight on all this. I know a lot of people are really interested to hear from it.
Yeah, of course. I look forward to chatting about it, answering any, questions that people have. So,
Yeah. Thanks, Chris. For coming on for sure. It's been, like Shane said, it's been a process to get you on here, and I think, finally getting you on here and getting some of the information from a doctor, not just two Jamokes firemen that think we know what we're talking about, right? So I think a lot of people are going to get a lot out of this podcast for sure, and some different things we're going to talk about is the pros of both sides, or the pros and cons of both sides, depending on what sides you need, why and why not, and just some of the data I think that you've seen, because you've been doing this for quite a while, and I feel like you know a lot about what works and what doesn't work, because there's a lot of, I think, misconceptions out there of how it works. Which side do you need to get? Uh, do you have to get it redone? How long does it last? All that kind of stuff. So, yeah, if you just want to kind of hop into it and give us a brief history of how long you've been doing it, and take it away.
yeah, sure. I mean, I think it'd be important to give just a little bit of background about, everything that you guys go through. And you live it every day. You see it in, your brothers and, sisters and firefighters, and then other first responders that are out there. But first responders experience trauma at a far greater rate than the average civilian, kind of negatively impacting their mental health, personal lives, and sometimes even their ability to perform best at their job. The average first responders, firefighters, police, they experience hundreds of traumas, throughout their career, often even, at much greater rates than even, some of the military service members. The majority of the guys that are really kind of struggling often feel trapped or helpless in their job, at least, maybe once a week. Interestingly enough, these are things that I had to look up, but the life expectancy is only, 57 in most first responders, which is about 21 years less than, the average American. And workers' comp claims for PTSD can cost, upwards of 300,000 to often over a million for when those are, submitted. Um, Often some of the common barriers, for first responders is just the stigma, the mental health stigma. No, I got to tough it out. It's how we were trained. It's just how it is. Kind of the reluctance to even seek help. Kind of that, uncertain of what the therapies are, how they'll help. Of course, medication related concern. That's kind of a big one for people. I don't want to be on medication. I don't want to lose my edge. Just even the simple diagnosis is often concerning for a lot of people kind of seeking treatment. There's a much higher dropout rate because of that. Oftentimes it can be kind of lengthy for PTSD, the treatment courses. And then, just the cost is some of the barriers. So thankfully, there's been, I think, a kind of significant push in the first responder, even the military world, to really take mental health seriously. I wish, the insurance companies and workers' comp would look at it even more so, because I think you would see, using these different type of kind of cutting edge treatments, we would actually lower costs, lower missed days at work, lower hospitalizations, lower use of medications, therapy, things like this by doing this. So in the long run, I think it would actually be of, financial benefit to do the simple things like the stellate ganglion block. So trauma is, it's not some mysterious or invisible thing. PTSD is an actual kind of biological, injury. And it can cause, we've shown, neurological and cognitive, kind of changes in behavior and other things. So how is the stellate ganglion, used for trauma? So what it does is the stellate ganglion, kind of think of it as the CPU, the control center for your fight or flight response. And what the block does is it kind of targets the hyper, reactivity symptoms of PTSD. And in essence, what it does is it reboots that system. So I can take somebody that's like a 8, 9, or 10 on their fight or flight, and with the block, pretty quickly take them back down to a 1 or a 2. As you guys have seen, and maybe those of your colleagues that have had it, a lot of people just feel this instantaneous sense of calm. I've had some first responders that have slept for 24 hours. Everything resets. So, recurring thoughts go away, sleep gets better, triggers just aren't there. One of the biggest questions I get asked, especially from, the first responders, firefighters, and especially police, is, am I going to lose my edge? And studies have actually shown that you get faster, because when you're under all these stress hormones, your responses actually get delayed. And when we do the block and we reset that, your thought patterns are more clear. You really rely upon almost that muscle memory and training. And, you think clearer, and responses tend to be faster. So, um, that's just kind of a quick sort of general overview about it. So the stellate ganglion block itself, it's no different than going to the dentist and having, your the nerves to your teeth numb. We're using basically kind of the same thing. And we're resetting that sympathetic system. And what studies have shown is in people that have kind of recurring trauma, that the area of the brain where trauma is stored is called the limbic system. And it's kind of composed of the amygdala, the hippocampus, and something called the prefrontal cortex. And those areas of the brain in people with PTSD, it's just being flooded with, the neurotransmitter, one of them being norepinephrine. And when we block it, we basically immediately shut off that spigot. And that's why, people feel better. And it can take, oftentimes people that have had trauma in the past, they only may need the block, once. I like to see kind of a minimum of 6 months. And that's usually what we see a lot of times in first responders, because, we'll take you back down to that 1 or 2, but then you have that daily trauma, and that, you're now stimulating those areas of the brain again. And, after 6 months, you may need what we call a booster. Although I oftentimes get people that are more than a year out. Everybody's a little bit different. The beauty of it is, though, is when you're in that calmer state, everything else that you do, the grounding, the cold plunges, and the therapy, the EMDRs, the grounding, all that stuff just seems to be much more kind of beneficial to you, because you're in that, that calm state. Oftentimes we'll see people come down on, their anti-anxiety medications and other things. Their interpersonal relationships get much better. I had a PD tell me it saved his marriage because he was no longer, on edge at home with his wife. So you definitely see oftentimes an almost instantaneous, change. So that's just kind of a general overview.
Yeah. I took a couple notes, Doc, while you're talking. I've also got this question. They're like, what do you mean when you say reset? You talked about reset. What can you kind of go in detail a little bit more of what you mean by like the system's getting reset? I know you kind of talked about your like shutting off that flow, right, of certain things. But if we can kind of talk about that, that'd be nice.
Yeah, so what happens in in trauma or PTSD is that sympathetic system's in overdrive. Normally we want it in balance with something called the parasympathetic. You've probably heard of vagal. So it's basically a delicate balance that the body has between the two. And what happens in the PTSD is that instead of, being in balance with that calming side, the parasympathetic vagal side, is that it gets revved up. So when you're revved up, your brain is being flooded with basically noradrenaline and these other things. So your heart rate is up, your blood pressure is up, sleep is affected, your cortisol levels are up. We've actually found biomarkers for PTSD. So you're actually on a genetic level changing yourself, with the trauma that's occurring. You are much more on edge, so sounds can startle you. Certain things can trigger you from, thoughts to smells to touch. All those things are in a much kind of heightened state. And I kind of equate it to those areas of the brains are growing almost like little nerve endings that look like dandelion spindles. And each of those little spindles is, pumping out that norepinephrine or noradrenaline. And when we do the block, it's like blowing those dandelion spindles into the wind, and that's kind of why people feel it. So we've shown like heart rate variability, blood pressure all comes down. Like heart rate drops, 20 points right after the block because you're no longer in that fight or flight kind of mode. Doing things like the vagal maneuvers then also bring that up in balance. And there's some people now that are looking at resetting both. So it's, you do the sympathetic block and then you also do the vagal block. And there's some early sort of studies showing resetting both is a benefit. So you take, you're at an 8, 9, or 10 on your fight or flight, and you're at a 1 or 2 on your sort of calming, vagus. And then when we reset both, we bring them both kind of into equilibrium. So there's, especially, I've been starting to do it in those that have a lot of GI symptoms because a lot of the vagus is controls like gut function. So you'll see people that have really bad PTSD with, GI symptoms that if you do both, they both get, much better other than just blocking the stellate ganglion. So yeah, our autonomic nervous system controls so many things. And when it's, it's out of balance, it really leads to, unfortunately a lot of detrimental aspects to our kind of daily living.
Yeah.
Yeah, I think you mentioned the heart rate variability. That's been something that I've focused on for like the last year. And, because of everything you just said, and you've explained this to me before, and we've had lots of discussions. I think that, I still try to wrap my head around what heart rate variability really measures and, the range that's what is good, what is bad. I mean, I've read all this stuff that something along the lines of the highest I've ever heard of is over 200. You know, mine is in the 30s to 40s consistently. And that was an improvement after my holiday in the summertime. I went down to the islands and went diving for 2 weeks. A lot of times it was in the low 30s and in the 20s. And what I was reading is that that they were saying, essentially that necessarily that's bad, but just that that's my baseline. And a lot of it has to do with, I think, with what you're saying, that parasympathetic for me is probably so much on the lower end. I've never had like the vagal reset or anything. Um, and I think that kind of dovetails to what Eric was saying. We both get a lot of questions, and I'm sure you do this. Well, how often do we need to do this? I mean, like, yeah, okay, fine, I understand what it does. I can go get it a shot, but then, as you said, we're gonna get exposed again. So what's that balance? I mean, we've we've talked to you frequently. We have a lot of loss in the fire service a lot. I mean, this week's been a rough one. We lost a person here in Fresno just today. Eric and I lost a friend. Um, so it's just one of those things. It's like a lot of my friends that I talk to, it's kind of one of those, hey. just because you have a bad day or some rough times, that doesn't mean you need to go get a shot, right? But how do you find that balance, and how do you use things like a whoop strap or some sort of biometric device to measure your heart rate variability in your own biometrics and kind of know like what, as far as like if somebody were to call you and say, hey, this is what's going on. When do you tell them, yeah, it's time for you to come back in versus saying, hey, maybe you need to do a little more work. Maybe you need to go back and do some talk therapy. Are you doing your cold plunges? Are you doing your sauna? Or are you just trying to run back in for a shot in the neck every time you have a bad day? Because I feel like there's a balance.
For sure.
Yeah, and that's an absolutely excellent point. And I try to stress this all the time. Like the shot is not a magic bullet. It's not. It definitely helps. It helps with like the reset, but you need to do all of those other things in order to hopefully that I don't have to see you again. So the beauty of the reset or the stellate ganglion block is, oftentimes when you're in your PTSD, you just can't even think clearly to let that other stuff even be of benefit because
Hmm.
you're sitting there doing your breath work and you're like, why the hell am I here? Well, I can't concentrate. My mind's running a million miles a minute. My heart rate's up. I don't want to be. Same with therapy, same with, everything else is that you just are not in that calm state to truly let all of those other things be a benefit, from the cold plunge, from, all of the amazing things. So I say that the block just helps you, achieve that calmer state so that all of the things that, you should be doing are of more benefit. And I tell them all the time after the block, if you're up for it, take a walk, do the things that, truly bring peace and calm to your life. And when they're in that state, I think that stuff comes kind of flooding back. In terms of, when do they need it? Well, I think if their thoughts or if their trauma or their fight or flight is interfering in any way with daily life, not only work but interpersonal relationships, your health, and having things like biometrics, biosensors showing, hey, look, my heart rate variability sucks, my sleep sucks, because of all these different things. I'm having to start blood pressure medications. I'm having to, be put on medications for anxiety. These are all signs to me that the block would be of huge benefit. I mean, we've done studies where it decreases just generalized anxiety by over 50%. So it is a benefit. It's, as you guys have seen, it's very easy to do. It takes me less than 5 minutes once I actually start to do it. And something so simple to, make you feel better that is not a medication. It's not a psychotropic drug. It's not, any of those things. I think that's why a lot of the first responders and even the military are starting to embrace it more. And I'm seeing and working with some of the like first responder, wellness, which is a amazing organization that helps a lot of you guys out, is that they're starting to embrace this, kind of tool, especially for some of the most, difficult going through where they just don't seem to be making a lot of progress. And then boom, they get the block done and they're back home and, in a few weeks and, they're back at work and they're feeling great. So, the beauty of it is there really isn't a lot of downside to it. In terms of side effects, the biggest we want to see that sense of calm, that sense of peace, return to you guys. So
What what do you exactly use for the block? What's the medication? And I've also got the question on the Horner syndrome.
Mhm.
That's a positive effect of what you get. Kind of looks like you're having a stroke. But is it is it two medications? If you can just kind of explain the process a little bit of what you do and
Sure.
yeah.
Yeah, so there's a couple of different ways of doing the block. I use ultrasound. I think it's the safest. The beauty of the ultrasound versus say X-ray. One, you're not being exposed to X-rays. Two, with ultrasound, I can see blood vessels, nerves, really your anatomy quite well. It's also, I think faster and safer to do it that way. So I use something called bupivacaine. It's a local anesthetic. When we do the block, it lasts anywhere from about 6 to 8 hours. Yeah, the beauty of the human body is what when I block the stellate ganglion, I get something called a Horner syndrome, and without it, I may not know if I actually got, the stellate ganglion. And what you see with the Horners is the side I'm doing it on, you get an eyelid droop, the white part, which is called your conjunctiva, turns kind of pink red. The pupil actually gets smaller. And those are kind of the three markers of a Horner syndrome. And I tell everybody it comes back to normal, I promise. But that sense of peace and calm we want to, pervade. 25% of people may feel some voice changes, congestion on that side. That's just because when we block the sympathetic, all the blood vessels, dilate. So the nose gets congested. They may feel some redness. That's why the white part turns, red. It's getting filled with the blood because we've dilated it. Again, all comes back to normal. But for some people, yeah, if I don't explain that, it's a little bit concerning to them. They think they had a stroke. So I say don't go to any parties or have pictures taken, things like that.
For sure.
Uh,
As far as the right and left side,
Sure.
what do you think? How do you know? Because there's, the right side is more for adult stuff. The left side's more for childhood stuff. And, like I had what's called the paradoxical, and we talked about it, right? And it was like, well, maybe I didn't need the left. So I don't know if you can kind of talk about that a little bit as well.
Yeah, so trauma is so complex and how it affects the brain, especially kind of developing brain. The brain actually doesn't stop developing till about the age of 25. So, when people have what we call high ACE scores, which is basically a marker of childhood trauma, there's some theories, and it's hard to, truly know because everyone's a little bit different, that it affects both sides of the brain. A lot of trauma, it seems, tends to be right-sided, which is why we start with the right. And some of the studies that have been out there say about 80% of people get relief just with the right side. And what I have seen in first responders that it's probably a little bit less. It's probably, 65 to 70% maybe with first responders get relief just with the right side. And I think that's just due to the level of complexity of the trauma, that it tends to, kind of shift to both sides of the brain. And for me, a positive response is, they feel great. So they're much calmer. Their triggers have gone away. Their um, recurring thoughts have gone away. Their interpersonal relationships are better. Their sleep is better. When they have that, and let's say they say, oh, it feels, 80, 85% better. To me, there's no reason to then do the left. We're not going to get a lot out of, doing the left. Now, in those who are like, it's hard to say. I feel maybe a little bit calmer. I'll talk to their significant others or colleagues and like, yeah, he definitely seems more calm. In those, then I actually do recommend the left. There is a risk of something called a paradoxical reaction. So what that means is, and I've only seen it in people that had amazing results with the right. So like you, Eric, you had the right and you felt great. You did. You're like, wow, this is calm. I can't remember the last time I felt like that. And you're someone that I just don't see needing, the left side. Unfortunately, you got some bad advice, not from me, but from outside sources, and had the left done and had one of the worst paradoxicals I think I've heard about. Everything came flooding back and even worse, for you. The treatment for that is we then have to go back and block, the original side. But what we're seeing is that you never really, let's say you were 95% better, I may be able to get you back to 80% better. So for me, I take the paradoxical very seriously. Some of the initial studies were showing like 1, 2%. I think it's actually higher if you're not paying attention to it. I've heard of providers out there that don't believe in it, and excuse my language, they're idiots. Because I've seen it. I've seen people develop suicidal ideations from, these paradoxicals. But if you have a provider that knows what they're doing, then we never would do, the other side. It'd be like, and I've canceled, blocks for the left side on days where, it's a couple weeks out and they're feeling great. And I'm like, you know what? I don't think you need it. We'll see you in 6, 9 months, for the right side. So the most important in terms of preventing that is just to follow up, really, sitting down, chatting with them and seeing how they're doing. Um, the beauty of it is, we can tell pretty quickly, after within a week, whether I think you're going to need, the left side or not. I've only seen one paradoxical from doing the right side in my entire career. We then blocked the left and she felt better. So for whatever reason, in her trauma was all on, the left side. And when we blocked the right, and I think nobody really knows, I think kind of the reason for a paradoxical is that the opposite side of the brain from the trauma is almost like a gatekeeper. Think of it as sort of that calming effect that, even though your your symptomatology is off the charts without that other side of the brain, it would be, not even tolerable. So I think what happens is when we take that kind of gatekeeper out of the equation, is that everything kind of comes flooding back. Um, so that's why, let's say you get amazing results with the right, there's no reason to do the left. So, and we're still, the stellate ganglion, even though it's been around for about 100 years, which was used for some pain syndromes, interestingly enough, some menopause and some other stuff, it's only really been looked at for trauma over kind of the last, 10, 12 years. So we're still trying to figure out exactly, why it works, what's up with this paradoxical, and, things like that. But there's studies to show it should be kind of a, first line treatment for PTSD. And I know the firefighters have those centers of excellence. There's one out of Maryland, and they often, recommend it for everybody coming in their program. There's one, I think, being built here in Hemet, and hopefully they'll sort of have the same policy, because I do think it helps coming into those programs to, really get, settled in. That being said, there are some, contraindications. Somebody who's in acute detox, they need to be sort of stabilized before, we can do it. Somebody that's, very labile, I think it's good for them to be in their programs for, say a month, and then we sort of address, the block at that time.
Yeah.
So hopefully that
That
answered kind of the questions on the paradoxical.
yeah, and that's the next question, Shane, because that's where you went, was a center of excellence in Maryland. And we talked about the stellate ganglion block, but you actually did not get the DSR, or the dual sympathetic reset, initially, correct?
Yeah. Yeah. The yeah, my initial exposure, how this whole thing started and us meeting you, Doc, was my trip there to the Center of Excellence. I mean, I know you know the story, but for any of the listeners that don't, you can go back to some of the previous episodes where Eric and I talked about it. Um, that's exactly kind of what a lot of the sort of the treatments are built with the idea in mind that, that biological reset. When Eric and I explain it to people, we talk about it as like a torn ACL. We say, you tear your ACL, it's blown, like the ligament is torn in half. The only way to fix it is surgical intervention. So you can go to do rehab all you want. You can lift weights, you can do yoga, you can stretch, you can build all the muscles around it in your leg, and your leg's going to be stronger. But at the end of the day, your ligament's still torn. So you're going to step wrong one day, it's going to hyperextend. It's still injured, and that's a lot to me what this is exactly what we're talking about, where your brain is injured. You can go talk, you can go do EMDR, you can jump in a cold plunge, you can jump in a sauna, but at the end of the day, the injury still exists. And this allows that sort of biological reset where, as you said, all the therapies then actually absorb and work. So when I had mine, I had a single right side. I've said it many times, like I didn't feel anything when I walked out. I'm like, well, I guess I'm one of those 20%. It just didn't work on me, whatever. And I had to really pay attention to these little things that started to indicate to me that something had changed, things that I wasn't feeling the same visceral reactions to certain things. I started noticing I was present. I did start paying attention all of a sudden, like, because I thought I was calm prior, you know, and so then to know what calm looked like afterwards was a new thing. So, um, yeah, when I came back and met you and kind of with the program you were on at the time with the DSR, the dual sympathetic, um, and then pumping the guys I work with and the people that are in my immediate circle, Eric being one of them, down there getting the results they're getting, including like multiple family members. It was impressive to say the least. I mean, I look at it like you guys really save lives. They always give us all the credit as firefighters, but the stuff that you're doing is literally like changing and saving lives of the people who are out there doing the first responder work. Because you are giving our lives back. I mean, it saved my marriage 100%. There's no doubt about that. Um, so one of the things I'm curious about is for yourself, like, yeah, I mean, obviously with HIPAA, you can't say names and we don't want you to, but just some of your success stories, like some of the people that you've seen. Um, because, and we're talking only first responders, but I'm sure you've seen people who have had all types of traumas. And just, so not limiting it to us as firefighters, because this podcast has gone farther than first responders. I mean, it's touched military people and then a lot of families, a lot of wives have emailed Eric and I. So, um, I would say anybody listening to that doctors like Chris are the people we want in our corner because I can tell you 100% multiple stories of him not trying to make money off people, but quite the opposite, telling them, I don't think you need to do this. Like one of our buddies drove down to you after having an amazing right side relief, very excited to get his left side because he'd gotten bad advice from someone else and thinking that it was necessary, and you told him, hey man, I'm sorry you drove all this way, but you shouldn't do your left. And that was kudos to you. And he appreciates it, we appreciate it, we learned from that. So anyways, what are some of the successes that you've had that I don't know if you're like I don't you probably like just what are some of the most rewarding experiences you've had as you provided this care for people?
Yeah, and that's an excellent, sort of segue, I think, that it is, more than first responders, it is more than military. I've taken care of a lot of, not only physical but sexual abuse, survivors. Trauma comes in many different, unfortunately, forms and beasts, and it still to this day amazes me how people, one of the first things they say is just like, oh my God, this is what, calm feels like. And I can talk till I'm blue in the face, but, when you guys actually have it and, speak to, other firefighters, first responders about it, goes so much farther. And it's the same with some of the people I've taken care of, because of HIPAA, I don't want to get too deep into things, but I've taken care of Larry Nassar survivors and Jeffrey Epstein survivors who have huge trust issues. And I remember this one, and she's like, you're the first male doctor that and she actually gave me a hug. And, like I said, I've had people say, hey, not only did you save my life, you saved my marriage. And it's an important point you brought up. I've treated a lot of, oftentimes, people with trauma, their spouses, significant others are having just as much. And we often overlook them, because people bring their trauma home with them. They bring their work home with them. And, the wives and significant others often have just this high level of PTSD. And I've found that blocking both, the first responder or the PTSD, and then, their significant other, that the results are better because they're both in that, calm state. They both deserve to, to feel that way. We've had people that said if this doesn't work, they were done. They were checking out. And, when it saved their life. And then, there's stories out there. One I can think of, he was a firefighter, and he and his wife were able to actually, conceive and have a child, even though they've been trying for years. And it just shows you what, stress hormones do to the body. And they're able to really work through things kind of for the first time. And I hear that a lot from, their mental health care providers, therapists, psychologists, psychiatrists. Hey, for the first time, I felt like I made a breakthrough with them because they were able to sit and actually chat with me. Um, but it's I'm an anesthesiologist by training, and I enjoy what I do, but it's not nearly as rewarding as hearing them. Wow, this is a game changer, and thank you. For the first time I feel calm. I don't have people coming out of the OR hugging me like I do with the stellate ganglion block. And you talked kind of about the dual sympathetic, and that's something that was looked at through a couple of people. Dr. Lipoff and Dr. Mulvaney kind of looked at doing two-level blocks versus single level, and we've actually found better results by blocking at what we call the C4 level and the C6 level versus just the C6 level. So not many people do kind of the two level, but I'm a firm believer in it. And the success rates are pretty good. Like I said, 80% for the right, and then of those 20% that need the left, about another 50% get relief. So overall, it's about a 90 percent success rate. Treated as young as 8, as old as 80. It just shows you that trauma kind of goes across all age ranges, unfortunately. We found it actually, weirdly enough, been shown to help in things like long COVID, and a few other things. So it's not just PTSD. It definitely helps in those that just have anxiety. Often had people that come in just treating their anxiety, or those with like OCD, which is often anxiety driven, and all that stuff gets better after the block. And they're like, yeah, I'm coming down on my medications because of it. So it's a game changer. And I think it is important to not only focus on, the individual that's coming in, but their immediate family, their, immediate circles, because oftentimes they're just as affected.
Yeah. You also talked about because there's different treatment modalities out there, and you talked about coming back in a week, because I know some information is get it one day, take a day off, and come back like the third day. But you said about a week, because like you might not need the left, you might just need the right. So how do you determine, or this is for the listeners because they've asked me, but why do you give a week for the system to kind of reset versus just doing it back to back? Why wait?
Yeah, that's just sort of my personal preference. I know there is some data, especially out of the special operators world, where they do it kind of back to back, but that's a different breed of, individual from kind of the general, population. I think you need a minimum of a week, and that's a minimum. I have people that may come back, 2, 3 weeks, even a month later, which I think is fine. But you need time for your system to reset. If you're doing it, say, a Monday and then a Wednesday, we just, was it the right side that was of benefit? And we then do the left, and like I said, paradoxical is rare. So let's say we do the left and it really didn't do much. Well, we can't find out that quickly, I don't think. So I like the system just to reset. I like them to kind of feel their bodies, feel, how the people and world around them are seeing them. Since I've been working a lot with, some of the first responder kind of wellness recovery centers, is that I'll speak with the therapists that are there, and they're like, I didn't really tell a difference. It seemed a little bit calmer, but, you know, by day 3 or 4, they're like, yeah, in group, they're much more engaging, and I can kind of see it. So they didn't have that the first 24 hours, and everybody's a little bit different in how they sort of reset. But to me, I think you need to wait a minimum of a week in between them. I don't really see any downside to that. Whereas if you're doing it kind of back to back, there's a lot of downside to it, a lot of negative things that could happen. So
Yeah, you and I have talked about this, and that's one of the things that I recommend to people before they go in is like, hey man, spend a week or two monitoring your vital signs. Try to get a baseline your heart rate, your blood pressure, your heart rate variability. If you can get one of those whoop straps or whatever device you want, so that you have those baseline numbers before you go in, and then when you come out, like you said, spend some time. Was there a change? Was there a marked difference? Because my wife got hers. And her resting heart rate at all times was 100 beats a minute. I mean, just sitting on the couch doing nothing, 100 beats a minute. Within 10 minutes, it was down in the 70s where it belongs, and it's pretty much stayed there since. She got hers in November of last year. That was part of what convinced me to get mine when I was at the Center of Excellence, was watching the signs, and or I'm sorry, the actual resolution of types of symptoms like that in individuals. So to me, the anecdotal things were, yeah, sure, you feel better. In my mind, I'm thinking it's placebo effect. These guys are just messed up. They want to feel better, so yeah, you stick a needle in their neck, they feel great, whatever. When I saw like I saw heart rate change. I saw one guy who, you talked about the GI problems, his irritable bowel syndrome resolved within a short time. Another guy whose BP dropped significantly, an ex-Green Beret whose BP was 200 over 100 and had been told by doctors his hypothalamus was smoked from all the combat he'd been in, and so he was on this enormous amount of meds that he was able to wean off of. So seeing those things to me was what convinced me to even check into it. But along with that week long afterwards, what's your take on, because firefighters were notoriously dumbasses. Eric and I are constantly telling these people, take some time off before you go do this, right? Don't get off shift that morning after getting your ass handed to you for 48 hours in a busy downtown, fighting fires, seeing trauma. Jump in your car, drink 2 cups of coffee on the road down to Irvine, and then go in and do this procedure and sleep on the table for 2 hours, and then turn around and have somebody drive you back home 5 or 6 or 10 hours. Like, spend some time before. I usually try to recommend to people, like, spend 4 or 5 days before they even come see you to try to just calm down, and then come in at the calmest they can possibly be. You hit them with the reset, and then give them another several days afterwards. So, what's your, maybe they'll listen to you being a doc, but they certainly don't listen to Eric and I. What do you think about that?
yeah, it literally it's about self-care, and but I agree. You need that sort of, especially after, you need that downtime. I mean, I tell people no caffeine, no alcohol, no exercise, no stressors for 24. And oftentimes people are grabbing their phone, and I'm like, that's the worst thing that you can do. Really listen to your body. And that's sometimes the hardest thing, for first responders. I mean, I still remember my days of, residency and being up for 2 straight days. And you don't listen to yourself. And the beauty of the block is that you can do that. And we're I'm working with somebody, and we're opening up kind of a fully functional wellness center, which I hope will teach a lot, of you guys to not only think about, the sympathetic reset, but every aspect of your life, from sleep, from diet, from, nutrition, from things like breath work and grounding, so that, yeah, we help you with the reset, but then I want to look at every other aspect of their life. The guy, Tom, who I work with, he is partnering with something called Molecular U, and they're looking at biomarkers. And what I want to do is I want to look at the actual, let's say you guys come in for your block, we look at your biomarkers that day for PTSD, anxiety, other things. And then in a month, I want to redo them, or 6 weeks, and be like, wow, look, on a genetic level, we have reverted you from, these PTSD biomarkers to normal. you hear that expression all the time, sins of the father. It's true. When we change ourselves on a genetic level from our stress or trauma, it gets passed on to our kids. But we can revert it. We can change it back, and we have seen that. And that's what I would love to do with the block is be like, hey, look, you came in, your PTSD markers were off the charts. Did the block, we've done some of these, things, and now look at you. You've reverted to what we call kind of a normal pattern. And I think people would love to see that, be like, wow, yeah, cool. I'm changing myself on, a cellular level. But all of that stuff is so important. Like I said, this is not some silver magic bullet. It's just a tool in your overall kind of, care. And I'm a big believer in some of these really cutting edge things that I think are coming down the pipeline, the regenerative stuff, peptides, exosomes, stem cells, in conjunction with the block, in conjunction with gut health. We want to, if you ever come into like my center, we'll do everything. We'll run a full blood panel, a full gut panel, full hormones, because oftentimes our testosterone is in the toilet from, PTSD and stress, and we don't even realize it. So, looking at all of those things and, doing the block, but then changing all those other things, I think will really put people on such an amazing kind of road to not only self-discovery, but, self-healing, health, wealth, and all of that from a mind, body, and kind of spirit perspective.
Yeah, I think you've touched on it quite a bit. It's a tool that we get to calm our body. I couldn't accept a lot of that stuff if it wasn't for Shane knowing me prior to to all the stuff that happened to me, and then him getting the shot. I did all that stuff. I did the basic therapies that the CBT, the PE, the all the trauma work, and writing out the letters to yourself, and just basically just beating everything down until it doesn't affect you anymore. Right? I get what the purpose is, but it still felt like something had me prisoner. And Shane would say that. He's like, dude, you're not present with me. And I'm like, what? No, dude, like I've been working my butt off for the past couple years, right? And that's something I want to, hit home. Like you said, Doc, it's like what it does is now your body is able to accept and take in what you're giving it. I thought it was accepting. I thought it was taking in. I mean, it was, but it was taking like a fraction of it. It wasn't taking everything because my nervous system just wasn't accepting it like it should. So with that DSR, the SGB, the Stellate Ganglion Block, since my nervous system was now, I always think about it as I felt at home again. Now it's like I had to retrain my body and retrain my mindset, my thoughts with everything I learned the past prior couple years. But now that stuff was sticking. It didn't take any work away. You don't have to plunge now. Oh, you don't have to journal now. Oh, you don't have to meditate now. Oh, you don't have to do all those things, right? Yeah, you still, do some therapy if you want. You still do, I cold plunge every single morning. That's in my daily routine, but that stuff now sticks with me. I'm able to actually meditate in the cold plunge and get my mind in the right mindset to actually focus on what I need to focus on, and I don't lose it by the end of the day. Like it gets better, and it's like a building block, and it gets stronger versus I always felt like I was going to lose it. And Shane brought that up, and I was like, that's exactly how I feel. If I don't do one thing in a day, I'm going to lose months of work. With a shot, it's not like that. It's like I'm not afraid to if I miss a journal today, or if I miss a plunge today, or if I miss a therapy or whatever, it's not like the death of me. It's like, no, man, it's just life gets busy. Life is stressful. It's challenging. Get right back to it. Before, I had like this nervous tick of like, if I don't do everything, I'm going to lose all my work because that's how my body was trained.
Yeah, and that's an excellent point, Eric. And I think that comes back to something that we've all heard of, neuroplasticity, and kind of rewiring our brains and how we think. Unfortunately, when we're in that high sympathetic drive, you were doing everything that you were told is going to help me. You know, the cold plunge, the journaling, the CBT, the EMDR, all of these things. Unfortunately, there was a huge, roadblock up to rewiring your brain. You were, like, oh, okay, I'll do these things and they'll get better. Unfortunately, when we're in that trauma state and our brain's being bathed with, these trauma um, thoughts, trauma hormones, trauma everything, those calming pathways can never open, can never regrow, can never fire. And once, we did the block and we're in that calmer state, all the stuff that you had in the pipeline and we're doing now was so much more beneficial. And that's what we see. And that's the exact type of thing that we want to, get out there. This block is going to help you feel calm. Now let's add all of these other things in, to truly, and you're right, life does get busy and it's okay if, tomorrow you can't cold plunge because you have a million and one things. You know that Saturday you most likely will, and it's not going to affect, how you're doing. When you're in that sense of calm, things just seem to flow so much better. We're always told, live in the now, don't live in the past or the future. That is the single hardest thing to do. It truly is. Like, they make it out to be like, oh, it's the easiest thing in the world. It's the easiest thing in the world to hear, but it's the actual hardest thing to like institute. But I think when your brain isn't flooded with, all of these trauma thoughts, is that it does make it a little bit easier to, to be in the now. So when you're sitting in that cold plunge, you're focused on that, or when you're journaling, you're focused on that instead of, oh my God, I got a million and one things to do, and holy shit, what happened to me, yesterday, and I got this coming up and all that other stuff. You're actually able, when you're in that calmer state, to stay in, the kind of the present moment, which is the greatest place to be for all of us. We often forget. So,
Yeah.
So uh, we've had so many people that we've sent your way that you've treated, and a handful of them have gone through it and actually done right and left. Like right side, they, moderate to not enough results. You felt comfortable moving forward. Left, you did left. Eric and I talked to some of them only I've talked to. Um, and I've had interesting conversations like the people I'm talking about, for instance, are saying, I don't think it worked. Hey, I took a shot, but I'm in that 10% or that 20%. And then as we push them a little bit, ask questions like, well, nothing's changed. You don't see anything different. It's funny how people start, well, my kids say I'm more present and I actually feel empathy for patients again. And I'm laughing at the fire station. I mean, it's like all these things that are obvious results that happen, but they don't see it. They don't understand it. And it's funny seeing sometimes like a frustration that they have. And I'll joke, a buddy of mine, I'm like, well, you were a dick before you got the shot. That wasn't going to change you. You're still a dick, right? Like it doesn't change your personality. Um, but all joking aside with that stuff, there are people that it doesn't necessarily, they aren't able to truly feel or see the outcome that we talk about in the various stages. So after that, after somebody goes through that, I know that you've done the ketamine routines for some time now. You're very versed in that. We get a lot of questions on that. What's your take on that as far as like ketamine goes? Like, so if somebody were to come to myself, Eric, or anybody and say, hey, I've heard about all this stuff, but I'm a little bit more hesitant on the SGB shot, but I'd go down the ketamine route. Do you feel
mhm.
like the SGB first is important prior to ketamine? Do you feel like it doesn't matter? Just curious what your thoughts are on that.
Well, there are some unpublished studies showing the combo of the block and the ketamine is absolutely amazing. Something like 6 months out, 70% of the people that did the combination of the two had complete remission of their PTSD, anxiety, and depression. So there's definitely some great synergy. I've been in the ketamine space since 2016. I'm a huge believer in it. The one thing that a lot of people don't understand, even those in the ketamine psychedelic space, unless you've really kind of paid attention, is that A lot of psychedelics are what we call sympathomimetics. That means we actually increasing your sympathetic system. So I'll have people that are like, initially they do their one or two ketamine. They're like, whoa, my anxiety went up. And then it comes down as, we're continuing on in the process. So that's why I'm kind of a believer in doing the block. And then, the ketamine, we take that sympathetic drive away. Uh, but back to kind of your initial point, yeah, it can often be subtle, and that's the one thing that we really need to. That's why I love speaking with, their colleagues or their significant others. Like, yeah, we actually see the change, even though he doesn't. He is joking more. He does seem more relaxed. He's not, screaming at the kids and this type of thing. They just don't see it, and they need those kind of reminders. Um, I am a huge person on, hope. I think hope is probably the best of things. And if the block doesn't work, there's always something else that we can do. And psychedelics are yet another amazing tool. There's a lot of, data out there that's pretty compelling on it. I saw an amazing film called In Waves and War. And it was about basically special operators, journey to treating their PTSD through ibogaine or iboga, which is a very powerful um, psychedelic. And this was a study done out of Stanford. And the film, which literally you guys should see it, it's one of the most intensely powerful films I've ever seen in terms of going through their training and then their time in like Afghanistan. Some of their battles are done in this like noir cartoon, and it's almost triggered me watching it. And I'm not in the military, and I'm not a police or firefighter. But then, it shows how much they struggled, and then when they went through, their ibogaine journeys and finding, in essence, that kind of self-love again and that healing journey. I mean, it's amazing. So my whole point is that, even if, say, the DSR, or the stellate block doesn't necessarily work for you, there are other modalities, and I've seen ketamine really save people's lives, change it. I've spoken with people that have done, the ibogaine, the MDMA, the ayahuasca, the psilocybin, and it saved their life. That being said, you still have to do the work. You know, going down and doing an ayahuasca journey, you gain all this insight. That's great. But unless you're still doing the work, you're going to be right back down there in 6 months saying, well, it helped me for a little while. So when I do my ketamine journeys, I really make it such an important aspect. Like, you sit with me, I'll set your intentions for that. I prepare your mind for that journey. I use, some virtual reality, a company called Firefly. They have some amazing stuff like doing, ritual breath work and setting intentions and letting go, and that prepares the mind to open those kind of healing pathways. I say to everybody, the greatest healer you have is actually within your own mind. We're just here helping you find, those doorways, those pathways to healing yourself. And the psychedelics have been shown to literally kind of light up all of our pathways. And I think the mind wants to find that, pathway to healing. And when all the doors are open, your mind will find that one that it wants to go down. I then give you a series of, questions to journal afterwards that, you answer, you sit, you think about. You're going to remember your ketamine journey most likely. And then, you follow up with your therapist, and then your therapist can set your intention for whenever your next journey is. But it's just, again, all part of kind of a multimodal approach to healing. It's just one kind of spoke on that wheel. But it's a powerful, very important one if you're open to it. If you're open to kind of exploring those different realms, I call it the cataverse, because you are in different places, you're seeing different things. sight, sounds, colors, can all be heightened. I've done a journey, and I in rocket ships and underwater and in Mario World, where everything is just so bright and colorful and you're flying through it, and and you just start feeling better. That's, because you're now firing what I call those happy pathways. You don't always understand, but you just wake up and you're like, hey, I feel good today. And it's really been shown to, help a lot of people when done in conjunction. Addiction, it's been shown to help when done in conjunction, with therapy and other things. So yeah, it's a real game changer. And then when done in conjunction with the block, I've seen amazing things.
Yeah. Do you think so? If you had like an ideal path for someone, um, SGB, then ketamine, therapy first to prepare for the SGB, or SGB then therapy, kind of thing. So if you had like an ideal path to set someone up for like, hey, here can be, the best blueprint for a journey if you put the work in. Do you have an idea of how you think that would look?
I mean, I would hope that they would come in with, a mental health care provider, someone that they're speaking with and working through things. Then, the beauty of the combo is it's only kind of a 2 week thing, so it's pretty quick. So let's say we do the block on a Monday and then ketamine Wednesday, Friday. If you then need the left, we do the left the following Monday and then ketamine Wednesday, Friday. So over a 2 week period, we're really, kind of changing lives. I want them integrating between their ketamine sessions. I work with some amazing integration, therapists. And then to continue it on, they may need like once a month, kind of what we call boosters. A lot of the initial studies with ketamine did kind of 6 infusions, and that's what a lot of centers sort of initially start with, but they're finding, hey, they may need, after that six, once a month for 6 months, or, once every couple of weeks for a couple of months, and then they start spacing it out depending on how they're feeling. And so we sort of really tailor it to the individual. There's no hard and fast rule with it. The beauty of it is we get a lot of people, antidepressants only work in like 30% of people. There is some new stuff coming down the pipe that may be a little better, but I'm just not a fan of antidepressants. I think there's a lot of downside to them. And they prevent a lot of people from, I think, doing the really work that they need to do in terms of sort of total body wellness, getting out there, grounding, being outside. There was a study looking at, I think, psilocybin versus, Zoloft, and they saw 3 weeks out that the people in the psilocybin, they just wanted to be around others. They felt like this kind of connection with the world around them in ways that they never did versus the antidepressant wing that saw none of that. So, does it, when we're depressed and isolated, it keeps us even more depressed and isolated. And I think these treatments allow us to kind of reconnect with the world around us, which is so important because, we're human. We need interactions. We need, those type of things to, feel wanted, feel cared about, feel integrated. So for me, it's multiple levels of, care and treatment and self-care, things that we can do.
There was something also you said. It's like, I know when I first started the journey a few years ago, things seemed very overwhelming. And when you talk about the work, if somebody's in that traumatic state and we're talking like, well, you got to put the work in, you got to put the work in, I feel like that might create more stress. And you're like, well, gosh, this is how much work do I have to put in? I mean, am I even going to get better? And I think in particular with the SGB, for anybody listening, that stress of like work will get taken down massive because your body's at a calmer state, and it won't, the burden or just that word of there was a lot of work. I feel like it takes it down so much to where now you want, because when you feel good, now you want to put the work in, right? And you're like, okay, well, it seemed so overwhelming in the beginning, but man, after the shot, 10 minutes, 20 minutes later, like, okay, yeah, you know what? I'm going to go see the therapist, or I'm going to go try a plunge today, or I'm going to go take a walk after, or I'm going to try this mindset thing or whatever. I think it opens up your mind now because you feel better. Because in the beginning, it's how I was, everything felt very overwhelming. And you were doing all this work, but with the shot, we just talk about it a lot because it changed my life. It changed my life, and you saw right away. I felt it right away. I was like, oh my gosh, if Shane wasn't a good friend like he was, and a stand-up guy, like, I'd probably still be stuck. I feel like my work really started last September. I mean, I worked, for a couple of years, about 2.5, 3 years. But I feel like everything stuck when I got my shot last September.
Yeah, I think all that work you did was just even so much more beneficial after the shot because you're like, oh, now that makes sense. The things that I was doing now that I'm in that mind frame mindset to truly enjoy all those things, truly work through all those things.
Yeah.
You're right. I mean, it's like flying a plane that's crashing. Uh, you can't you can't look out the window and enjoy, the mountain scenery or, the lakes because all you're focused on is making sure the plane doesn't crash. But when you hit that
Yep.
cruising altitude and you can kind of look out the window and be like, wow, this is beautiful. This is, an amazing life. And you start wanting to do those things and you start looking for those things because now your focus is on that instead of that survival mode. And that's unfortunately what happens with a lot of us with PTSD is we just go into survival mode and we get laser focused on that. And people can tell us all the time, oh, if you do this, that, you'll get better. I was having a conversation today with somebody about this where you read these books and this is all you have to do to like feel better. And she was frustrated because she's been reading these same books since she was her 20s and, nothing's changed. And I looked at her and I said, why that is because we embrace this chaos. We don't know anything else. When we get in that trauma state, it's all we know. We're scared of one letting go of that because we don't know what's on the other side. So we're like, no, 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 I'm okay with this. I can deal with this, level of stress, level of trauma, level of not feeling good. But it's just pure chaos energy. And when we start feeling that calm energy like you did, Eric, you're like, wow, okay. I like this. I want, more of this. Because chaos just begets chaos. It's a powerful energy, don't get me wrong, but when you finally feel that like calmness, you don't want to go back, to that way.
Yeah.
Yeah, it's tough in our business because we thrive on chaos, and that's where you feel normal. Is when we're going 100 miles an hour with lights, sirens, and all that, um, and you think you're calm. You think that's calm. You have no idea. So, um, well, what's your time frame on the Wellness HQ? Is that what you're going to still call it?
Yeah, so it's called HealthQuest Wellness.
HealthQuest Wellness.
I
Okay.
will have the MySpace probably open up in February, so a little
Oh,
over about 6 weeks, and I'll be doing the blocks and ketamine there. We're actually going to have kind of a relaxation room where I'm also going to be hopefully adding the cold plunge, IR. Should have a hyperbaric in there too, but then a whole room where, you'd be able to kind of relax. I've been speaking with somebody that does like, the sound baths and all of, those type of things. But, if you come in, I'll actually put you in the Firefly headset. We'll do some breath work and those type of things. So it's really going to be kind of a beautiful center, and I'd love to, do all the, the blood work and the biomarkers and the gut health, and truly kind of get hooked into that kind of total mind, body wellness. work with some functional medicine doctors and, those type of things. Because I think it's important, like I said, the SGB is a great tool, but we really want to kind of change everything. And, let's say you guys come in, well, we tailor it to you. You work through kind of your individual stuff and those type of things. We're setting up even a tele type of health where, specifically designed just for first responders. Oftentimes it's tough for you guys to, take time off, but, maybe twice a week, and the privacy of your own home, you're actually able to, speak with someone and kind of chat through things. And, if you need elevated levels of care, then they're there. We can offer it. So, we're really trying to kind of change things from that sort of initial, chat. So keep you guys, where you're at. Um, so there's a lot of amazing things kind of coming down, but hopefully be open in February for that. I'm doing the blocks right now at a location in Newport. I actually have 8 lined up for this weekend. I've been doing them on weekends and haven't even started advertising, but because of guys like you that, really know what it does. And we've, really established great kind of collaboration, getting the word out. I'm slowly, trying to get the word out about it. But yeah, if you guys are struggling, please reach out. I'm happy to chat with you, over the phone. And it's a game changer. It can really help.
Yeah, anybody that's listening that's considering it, send me Eric or I a message, and we'll get you in touch with Dr. Romig. I know I've been still probably at least once a week. There's at least one person, if not more, that I'm sending your way. Hopefully, they're reaching out to you.
Yeah,
Um,
yeah.
Good. What about the you and I've talked about the travel clinic, you coming up here.
Hmm.
We have here in the Fresno area, we have a building that we're partnered with for Red Helmet training to start some state fire training classes. The guy that owns the Southern California facility bought a building up here. Him and I have kind of partnered up to get the facility going as fire instruction, but we have a section of the building that we want to do kind of a mobile shot clinic where you could come up and maybe get 10 or 12 people at a time. Those are the ones that, can't really travel, um, or, just life's in the way or whatever kind of. I mean, at the end of the day, it's an excuse if they they can go down to SoCal and do it, but just trying to make it easier. So is that still
Yeah,
an
I'm
option we're
happy
going to be able
to.
to do?
Yeah, we talked about this. I'm happy to come up. I have everything to do a mobile unit, not only there, but I've had some places up kind of in the Bay Area that have asked me. And I've spoken with kind of the powers that be at HealthQuest Wellness, and we think that's actually a really good service to provide. And I may eventually have to, train some other docs that can do that. If I could clone myself, I would. But no, I'm happy to come up there. One weekend a month, and do 10, 15 blocks, not only on the firefighters and police, but spouses, family members that need it too. I think it'd be great. I think it would bring a lot more people, through the door, because it is a bit of a travel down here. But if you're like, hey, Dr. Romig's going to be here, Saturday the 17th or whatever, and just plan on it. But yeah, happy
Yeah,
to.
we definitely want to get that going. I just want to get it out there where people can hear you say it and know that it's a reality because I know it sounds kind of weird that, wait a minute, he can travel up here and do this? Like, where are we doing this in the back alley somewhere? Like, we've got a pretty nice place over there, nice facility, but as you've told me, it's really easy to move that stuff. You've got the mobile ultrasound. It's all the same stuff you would do in your home facility, right? It's the exact
Yeah.
same procedure, so
Yeah, I
nothing
bring all the
changes.
emergencies. Anything that's at the clinic, I bring with me. That's the ultrasound's the biggest one, and that's portable, so it's very easy for me to take. And I'll have a nurse with me that's trained, that's worked with me for a long time. So, and you can't be in a better place if there's a medical emergency.
Yeah, building full of firefighters. Yeah, you'd be all right.
Yeah, I think we're okay.
Yeah. So,
Anesthesia, I think I can take care of the airway all right.
Yeah.
So,
nice.
knock on wood, I have never had emergency doing these, and I never plan on it. So,
Yeah. As far as the twilight, there's quite a few people that don't like shots and their firemen or significant others or friends because it's not only for first responders. I'm glad you brought that up. But what is a twilight? And you do the twilight, correct?
I can, yeah. A lot of times it's not needed, but for those where, yeah, it's like severe needle phobia or it's really gonna they just won't do it without it. Yeah, and that's why I have, a nurse with me monitoring, the vital signs, things like that. Able to, offer what we call twilight, and it's basically just medication that helps you relax. Probably it causes a little bit of amnesia, so you won't remember, the procedure itself. And people do just fine with it. So.
Yeah.
The block itself is so fast. It takes me about 3 minutes to do it. Longest time is me just looking with the ultrasound, seeing the anatomy, make sure there's no nerves or blood vessels where I need to go. And then once I start, I just do two little local injections on the skin. They feel kind of like a bee sting. And once I start, it's 90% of people are like, "Whoa, you're done." That's how fast it is. So.
Yeah. I don't know about you, Shane, but people have asked me, what if he misses? What if he gets the wrong vein or hits, the wrong whatever? Like,
Yeah,
I'm
it
like,
just that doesn't happen with ultrasound. I see exactly
okay.
where, I need to go. That's, the beauty of, the anatomy. And of course, the stellate ganglion can lie in kind of, different places in people, but honestly, I cannot remember the last time I had to go in again because I didn't see that, that Horner syndrome. It's pretty consistent, where it is, and it's because of that Horner's, I know I got it. So.
Yeah. Any long-term effects that you've heard of so far? I know you said it's been out about like 100 years, but so far in the trauma, like 10, 12, 15, somewhere around there. This questions get
No,
asked to me a lot.
yeah, the only, like I said, we sort of touched on it, the paradoxical, which means we have to then repeat, the other side block. No, they're really, some people I've noticed have kind of that soreness from having a shot over a couple of days, but that's about it. No,
Yeah. Nothing years so far you've heard of, like three,
nope,
4 or 5 years down the road so far.
yeah, nothing that I've seen. Because with ultrasound, it's so very safe. I can see everything and, how it is. X-rays a little, it's harder to see the nerves and the blood vessels, so there's an increased risk of what you call intravascular. And I'm sure people are, YouTube, Google, and they're like, oh my God, seizures and all this other stuff. And that's just from people that aren't paying attention. You have to, and that's why I've never had an issue because you just have to be very careful. Yeah, it's a quick block, but if you're doing all the things that you're supposed to do, you won't have a problem.
Cool.
Why isn't it FDA approved?
That's an excellent question. It's what we call off-label use. We're trying to get it covered by workers' comp, and I've had a couple of people actually get it approved. Uh, I think they just haven't gone through the rigmarole that, it takes to get FDA approval. Especially, unfortunately, kind of in the, the psych world or the mental health world that it, things take a lot longer. Who's to say, look at MDMA, it got shut down by, the FDA for, approval. Although that could change, with the new head of the FDA coming in under the new administration. Who knows? We're trying, we're really trying to get it FDA approved. And if, we can show at the end of the day with insurance companies, it all comes down to monetary. If we can show that, we're saving a lot more money by doing this single block, then, we can get it covered and we're trying. We really are. it's just everything's so slow, you know. But
Yeah, and that's,
I'm
I
hopeful
mean,
for workers' comp. I really am. I'm hopeful that that'll be covered, for those that, have had to go that route.
yeah, we've started to make some progress on that. I mean, I asked you that facetiously. That's a loaded question because
Yeah.
we get that in the firehouse, and I just want them to hear it from you. It's we all have our little conspiracy theories, but I mean, the bottom line is there's no benefit in healing us if they can sell us Xanax and Zoloft and all this stuff. I mean, that's they're
Yeah.
making profit off people suffering. It sucks, but it's the truth to a certain degree. And even I think I've seen trepidation in clinicians. I mean, we had some presentations done here in my city where I don't want to say too much because it'll be obvious who I'm talking about, but a person was very resistant to even discuss it. I mean, just wanted to shoot holes in it. And it was like, oh, well, because you're worried you're going to become obsolete. We no longer need a person like you to lead our CISDs or our CISMs or whatever kind of thing. There's like an intimidation almost of like, oh, well, this sounds so good. And I hear so many people do well. Now you don't need me anymore, right? I don't need a therapist anymore. And it couldn't be further from the truth that, you're saying it, you still got to do the work. Me and Eric say it. Everybody that does
Oh,
it
yeah.
understands that. But a lot of these people are very concerned about those things. And, I tried to push it through a few times, still working on it. Um, but
Yeah,
I,
I'm
I
working with
find,
somebody who has some, higher ups in legislature. So we're hopefully going to change it on almost a legislative level, which is where I think ultimately it needs to go instead of having to battle on a, individual basis, which right now is how it is. I've had some people where it's covered and then others that it's not. And you're like, I don't understand why this person was approved and this person wasn't. They're almost exactly kind of the same thing. But if we can change it kind of on a legislative level, I think that would be, of great benefit. And, what I charge is so much cheaper than a lot of, institutions. I'm at 750 for the right side, and then if you have to get the left, it's 500. If you look around, a lot of places are $2,000, $3,000 for this, and which it really does a disservice, I think, to it because it's of such a huge benefit, and it shouldn't be out of, the price range, of people for this. So, I've really made it very reasonably priced, I think, for people. Um, but
no,
yeah,
I
I'm
know
hopeful.
that's one of the things that's driven me nuts. I mean, you and I talk about it a lot, but how the corporate greed has gotten in there to profit off people's suffering. I mean, we experienced it together as we've partnered with all this stuff, you, me, Eric, all of us, and just watched how, yeah, we had a discounted, they gave us discounts to, first responder discount, but it was still pretty damn expensive the way they had it structured, and we were making it work. But you and I talked a lot, and I'm grateful that that you're not out to try to profit off people's suffering, which is,
Yeah.
unfortunately, that's rare when you think it should be the norm in the medical world. So we're grateful for a doc like you in our circle. But I hope anybody listening, I mean, that's the thing is you've got to vet providers and you've got to build relationships with them, and work together on this. I mean, I've learned a ton from you. I mean, there's so many things as you talk. I think about these experiences we had. I remember, I'm sure you remember, at one point when we were working before, one of our people who said that the shots didn't work, which we know it worked for this person, but he just didn't, he didn't see it. He wanted to do the ketamine, and they first recommended home ketamine. They said, "Oh yeah, we'll just send it to you in the mail." And then he called me, and then I called you, and you said, "Absolutely not. That's a 911 call if it goes bad." And that blew me away. That how does that happen? How do we not even talk about an SGV shot? We can't get that authorized, but then they're going to send you ketamine to your home. Like, what
That's
are
a
we
whole
doing?
other podcast.
I know, but it's
Yeah,
just it's mind bending. So
that's a
what you're doing is
disaster.
amazing, and it's much appreciated. So,
Yeah.
um,
Yeah, at the end of the day, it's about getting people feeling better, where they wake up and they're just in a much calmer state of mind, much more peaceful. All of us deserve that, and it's ridiculous if that's out of the possibilities because of monetary stuff. The other thing is I don't push both sides. If you need the left, great, but I'm not going to push both sides on you at the beginning if you don't need it. So yeah, if you're going places where they say no, you have to have both sides, I don't recommend seeing them. You really need to be assessed after you're right before proceeding to the left. So.
Yeah.
And I'm happy to answer questions about, the ketamine therapy and things like that. I know a lot of people and all the sort of different modalities, psychedelics. As an MD, I can't touch any of those, but I've read a lot of studies and I've made some pretty good relationships with people. So
Yeah. No, it goes back to what Shane said, Doc. It's like I think we're very lucky to have someone that isn't trying to, screw people over on their suffering, for sure. Because I think that unfortunately happens a lot. And then the more that people get screwed over, the less they don't trust the system, right? Because the system isn't meant to heal us, right? It's meant to kind of make money off of us, right? Off the suffering. So when they actually, that's why we're getting this out the top of our lungs of like, hey, like hope, right? Like you're talking about hope, and when you're in that dark place of that, I like that analogy of the planes crashing. You can't look outside. It's like, yeah, that's how you feel every day. Like you feel like you're crashing every day, just surviving. To look out that window, oh, that's a nice sky. So you're not even thinking about that, right? Oh, that's a nice view. It's like I don't give a crap about the view. I'm just trying to keep myself alive today, right? And I think when people are in that state, it's like, oh, another treatment, another thing, another this, another that. They want to make money off me, and I think you just kind of get into that state. So for everyone listening, like it. That's why Shane and I started this podcast, with no ads and getting people that I feel like we trust to come on here because we actually care and want to see you better because everybody does deserve that for sure. And even if you don't see it, you'll get there if you put the work in for sure. You really will.
yeah, and at the end of the day, it's up to us to take care of ourselves. And I think the block just allows for a more level, clear thinking in order to find those things that truly are of help to us.
Yeah.
Modern medicine's an amazing thing, but as I get farther and farther, I realize we've kind of lost touch with truly treating the entire person. We break it down into, oh, they just have high blood pressure, or they just have diabetes, or they just have this, instead of truly looking at the whole person. And that's where I really appreciate kind of that fusion of, kind of functional medicine where they look at everything. They incorporate sort of Eastern and kind of Western philosophies. They look at mind, gut, body, everything. And I think that's important for all of us. And when we're in that clearer state after having the block, we're able to kind of see that and understand that and want that for ourselves.
Yeah.
I have one more question about so we just had a retired guy on my job. He committed suicide this week, and then um, we had another guy today who works in a Southern California fire department. Eric actually used to work with them. Um, Young guy, super good in shape, was having some chest pain over the last few days and didn't report to work this morning. So they had to do a welfare check and found him deceased in his home. Um, as these traumas happen to the fire department personnel and their families, I mean, is this shot something that, let's say that you have this kind of acute trauma that triggers something in somebody or whatever. I mean, is this something you would recommend? Hey, don't wait, get in, get that reset, let the dust settle. What do you think about that?
I mean, I'm so sorry for everybody's loss. I can't even imagine that. That's a That's a difficult question, I think, to kind of answer. They need the grief counseling, all of that. I have seen people come in for sort of that acute trauma. it may be of benefit. I don't think it's really been looked at. I think if it's acute trauma on top of, complex or PTSD, yeah, then it definitely would be of help. Oftentimes, with those, it's those grief counseling, the grief groups, all those things that are truly of benefit. So it may help as long as they have the support system.
Yeah.
Yeah, the question comes up. I mean, some guys asked me, and I just said, "Hey, man, it's not a one size fits all," is kind of what I tell everybody, and that's a lot based on what you've told me and taught us over the last, couple years. Is just that it is a tool, but it's this one hit hard. Well, both of these hit hard this week because both of these people were kind of the least likely. They're not people you would think these things would happen to. The health issue today is not something in a million years you would have ever thought would get this guy, and the one that worked with me was like cools the breeze, very, very chill person. And just to find out what he did, um, and why, it was kind of like, what the hell? Nobody knew anything, So, um, a lot
And
of
that's
people are
why,
in that shock right now.
yeah, and that's why we're really trying to develop this kind of telly thing. Because, maybe if he had somebody that was just chatting and, the signs were sort of subtle, but he was able to kind of share that being on kind of like a telly mental health, visit, maybe able to kind of change or get him help that, most people may not notice that, hey, this guy's, I think he needs a little bit of intervention. So I think it's important for that to be especially offered for, a lot of the different first responder places like Fresno and everywhere else around the state, just that it's there, and able to offer it. It'd be nice if I could just sign in and chat with somebody today. It sometimes can make all the difference in the world. So that's why we're really bring this up to speed quickly.
Yeah.
Unfortunately, the heart attack, that sounds like a genetic thing. Um, he probably never knew about, unfortunately. We hear about it in athletes kind of all the time. And young athletes, they just, they don't know because we're young and healthy. We don't think about that. But unfortunately, it happens. I'm so sorry for his family and all you guys.
Yeah.
Oh, thanks, Doc. Yeah, I mean, it's one of those things. It's hard because a lot of people don't want to talk about these things. I mean, but this is how we fix it, and it's how we put it on Front Street. I mean, everybody knows what's going on, and we want to make people aware. And it's I appreciate your time as always. I'd love to do another podcast with you to get deeper on the ketamine if you're up for it in the future. Um,
Yeah, it
you
might be
know,
benefit to bring in some people to just chat about their journeys.
yeah.
And how, I can remember one in your department who it saved his life. He drove down, basically suicidal, and whole new person now. So
Oh yeah, no, and I think he'd be willing to share. And um, yeah, I think it's first of many. I hope for the future. And I don't know if you got anything else for us on, or Eric, you got any other questions on that stuff for now?
No, actually, you know what? I do have one more. So, is there an intake that needs to be done
yeah,
to
so I
get the
basically have
shot?
I have some paperwork I'll have you fill out, just basic medical history, therapists you're working with, and then some scoring to just sort of, we gauge, like the PHQ-9s and PCL5s. These are markers of, kind of your trauma and how bad it is, depression, anxiety, those type of things. And then we sort of follow it and see, a month later how you are, which, that's our individual kind of scoring to see how you're doing. And then I would love to get, like I said before, into the biomarkers. So, we show a 20-point drop in your PTSD scores and a marked improvement in your biomarkers. And that's stuff that we could, publish and take to the insurance companies, be like, look, it's right here. We really should have this covered. So,
Cool. Yeah. No, that's all I got, man. I think it was great, Doc. Thank you so much for coming on for sure. I think, we've been fortunate for having you in our corner, right? And for all the guys and girls that have gone to get their shot and that have put the time to listen to this podcast, like everyone, I think it's just, making a difference for sure. And we couldn't do it, I think, without a team at all. So
Yeah, and they can check out my website, and then you can I'm happy to chat with anybody about this if they have questions.
yeah. So how would
What's the
people reach
website?
you?
Yeah.
Yeah.
So the website is HealthQuest Wellness. .com, and there's a whole tab on like PTSD. I think there's one on the ketamine too. And like I said, I'm happy to kind of answer any questions if they have individual ones, because oftentimes they do. But they could check it out on there, and amazing stuff coming down the pipe. So
Cool. Yeah. And you guys can reach out to me as well, epadgettcoaching@gmail.com. If there's any questions you guys have, we'll get you in contact with Dr. Chris Romig. Anything else from you, Shane?
No, thanks, Doc. It was great talking to you. So
uh,
we'll be seeing you
well,
soon.
yep. See you all soon.
How do they reach you, Shane?
Hit me up at ricfirecaptain@gmail.com.
Awesome. Well, thank you guys a ton. We'll see you on the next one.